Warning signs of a stroke. Stroke is placed one among the top 5 causes of death worldwide. A stroke happens when a blood vessel in the brain either becomes blocked, ischemic, or begins bleeding, hemorrhagic, both of which can cause severe damage to the brain and even death. A stroke, if it doesn't kill, it can cause serious physical and mental damage like paralysis, difficulty in thinking or understanding others, and blindness. It is preventable with exercise, controlling salt intake and keeping a healthy body weight. Unfortunately, the early signs of a stroke are often subtle, so many people might miss it. Fatigue without a real logical explanation such as hard work is an indicator of impending stroke. The body functions with a delicate balance of water and chemicals regulated with hormones. When this balance is disrupted, it can cause sudden onset of symptoms like fatigue. The brain manages the endocrine system, which in turn regulates the body functions through hormones. When a stroke occurs, the brain being damaged by a lack or total loss of blood to the affected area, it can result in a sudden and severe fatigue or lack of energy. Suddenly exhausted and lethargic for no good reason, one should see a doctor, as it may be a sign of stroke or other issue. The brain is divided into 2 hemispheres, each of which controls or is responsible for the opposite side of the body. When the brain is affected by a stroke, it can cause problems in one eye. It might be easy to dismiss this as just being tired, reading too much, watching too much TV, or working on the computer too much. Both eyes need to be focused on the same point in space together, to have normal vision. If one eye is off, because of the stroke, they are no longer working together perfectly and will result in double vision. A change in vision to just one eye could definitely be a sign of a stroke or other serious medical issue, and one should see a physician immediately. Like the double vision, a stroke will affect just one side of the body depending on where the blockage or bleeding is happening inside the brain. A sudden weakness or numbness in one arm or leg that doesn't go away in a few minutes is a sign of stroke. Woke up from a nap and arm was found numb, that would be easy to dismiss, but if it persists for more than a few minutes, it is a sign of something more serious and could be a stroke. When one side of the brain is affected by a stroke, it will interfere with things like body balance and speech. This could be easy to dismiss if person have been drinking even a little, but if it persists for more than an hour or so after the last drink, it might be a sign of something more serious. If one side of the mouth droops or having trouble in speaking, it could mean that the part of the brain responsible for speech or the cranial nerves responsible for facial muscles could be suffering from a lack of blood due to a stroke. The inner ear is responsible for balance, and a loss of blood to a portion of the brain that interprets those signals could lead to severe dizziness or vertigo. A sudden and severe dizziness or difficulty in speaking, then go and see a doctor. A stroke means that a part of the brain is being starved of oxygen and can cause one to be unable to focus or think straight. If a person has a hard time in expressing, or cannot find appropriate words for what want to say or don't understand what others are saying, then the person could be in the middle of a stroke. During a stroke involving a blockage, one might not feel anything in some cases. However, though most people who have had a stroke report it being painless, strokes involving internal bleeding may cause migraines. A sudden splitting headache or a migraine in a person who does not have a history of migraines might be the sign of a stroke. It would be best to have it checked out by a physician. Thank you.